All right, it is time to level up your game if you're a clinical supervisor and you work in the PCBH model. So let me tell you a little story. A little over 10 years ago, I was doing a lot of consulting to help clinics implement PCBH models, primary care behavioral health models. And I noticed that very few BHCs were getting good feedback about their clinical work because, as we've talked about on this channel many times, it is very different to be trained as a specialty mental health provider and adapt your skills to primary care. So together with some colleagues, what we did was we developed a simulation in a simulated clinic. And we had BHCs, we had fake patients, or standardized patients they're called, and we watched them through videos. And we used a tool, we developed a tool called the Behavioral Health Consultant Observation Rating Scale as a way to give feedback to the BHC clinicians as they were interacting with these standardized patients in this fake clinic setting. And the goal there was to figure out a way to provide structured feedback to behavioral health consultants that was effective, specific, targeted, that helped them really increase their clinical skills and move from more of a specialty mindset to a PCBH mindset. We ran 2 cohorts of clinicians over 2 years through this process, and we learned a lot through that process, and through that refined the instrument that we call the Behavioral Health Consultant Observation Rating Scale. And now what we've done at CFHA is we've just developed a certification process where we teach supervisors how to administer this scale. The idea is that as these supervisors basically gain the skill of doing observations like we did of those cohorts of clinicians, they then can provide better feedback to their clinicians and even certify those clinicians as having passed the observation process. And all this is in the aim of increasing quality of care and fidelity to PCBH. So let me show you the scale. All right, we're gonna go old-fashioned here. I'm just gonna show it to you on the screen instead of doing green screen. Basically, you see that it has 3 sections there. It has 23 items. The 3 sections are items related to communication with the primary care provider, the core components of the actual contextual interview itself, and then general efficiency items. So it's super awesome. You're able to give very specific, tangible feedback to your BHCs that they can use to improve upon and certify them as well in the process. So go to our page. You can go to cfha.net, and under the events tab, you'll find the certification in BHC ORS course. It's coming up here. June 11th is the next one. It's a 2-day course, and you've got